Good evening, and welcome to episode 14 of the Hope for Healing video podcast. I'm Dr. John Stracks. I'm joining you from my office in Chicago, and I'm here this evening with three current patients of mine, Leah, Brendan, and Matt. And before I introduce them, let me tell you just a little bit about Hope for Healing. Hope for Healing is a joint effort between the people at the Curable app and me. And for those of you who aren't familiar with one or the other, I'm a physician in the Chicago area who focuses on the elimination of physical symptoms using mind-body medicine methods. Curable is an amazing app focused on the same goal. We've been working together since their inception about 5 years ago. A couple of other notes before we get started. We're doing this as a panel discussion, which is unusual. And because of that, I'll ask both Leah and Brendan and Matt to give some background about their stories and then respond to some of my questions in turn. And we've given ourselves up to 2 hours to tell these stories and make sure that there's enough time for everybody to talk. If we do have a little bit of time at the end, we'll take some answers to some common questions. Secondly, I do want you to know that I've been able to expand my telehealth practice significantly during the COVID-19 pandemic. And I'm working to sustain that even once the pandemic is over. So no matter where you are, if you're feeling stuck with your symptoms, feel free to reach out to my office through my website at drstracks.com. My staff will get in touch with you to talk about how to set up an appointment with me to talk about your situation. And lastly, just a second to talk about my framework for talking about and healing chronic pain. Many of you know what we're discussing as mind-body medicine, meaning that our body can express what's going on in our minds or in our lives. And that's universal. We all do that. It doesn't make us bad. It doesn't make us sick. It only makes us human. And it really only becomes bad if you enter a medical system that doesn't understand this concept and assumes that all physical symptoms are physical in origin. Human beings have always expressed our lives in our bodies, and we always will. And so all of our goal is to help you understand that and learn what to do about it so that it's no longer physically uncomfortable or painful for you. And so with that, I will introduce tonight's guest. I'll give each of the three of you an opportunity to tell a little bit more of your story in a second, but this is just a little bit of a background to get us started. Leah, raise your hand, Leah. Thanks, Leah. Leah's an educator who recently left her classroom teaching job to work in educational policy. She got her first migraine at age 28, which then developed into debilitating daily headaches and migraines. Brendan, raise your hand. Brendan's an attorney and a commercial insurance broker. 7 years ago, he began to experience chronic pain and swelling in his right ankle and was told that he should never engage in high impact activities again. And for a while, he even struggled to walk short distances. Matt, raise your hand, is an attorney also who suffered from chronic pain in his head and arms for 8 years and was essentially unable to work, sleep, or at all enjoy life. And then each of the three of them in their own way found and was able to work with the idea of mind-body medicine, found me and started to work with me individually, and then met during one of my classes a little bit over 2 years ago. Once that class was over, they came to me with the idea of working in a regular mind-body medicine group, which has meant every single month for the past 2 years. And this working and being involved in a community of healing is one of the topics that we'll explore tonight. But first, I want to hear about their individual stories. So Leah, Brendan, Matt, I am super excited to have you here and to share your stories of initially illness and then healing. And I want to start by saying that I am super grateful to have worked with all of you, to be able to continue to work with all of you, and extremely grateful to have you three as my guests here on Hope for Healing this evening. So welcome.
Thanks, Doctor.
We have a lot to cover because you guys have a lot of stories to tell. And so I'm just going to jump right in. And our goal for the evening is to get everybody who's watching a sense of where you guys were, where you are now, and what you did in order to get to where you are at the moment. And so I'm just going to start calling on each of you one by one to go through aspects of this part of the story. So Brendan, before we started, you drew the short straw and we agreed that you would kick us off. So can you tell us a little bit about how you found yourself at a relatively young age in a state of chronic pain?
Sure. Well, first, just want to return the sentiment. Very grateful to be here and part of this group. Yeah, it's kind of sometimes when I get asked this question, I really don't know where to begin, especially the longer I've gone on. But I guess I'll just start with, kind of when the pain started. And that was about in my mid-20s. I was living in Chicago. It was a pretty stressful period of my life, practicing law as a young lawyer in a foreign environment, and had always been very active in sports, athletics. Really enjoyed playing basketball, tennis, running, cycling, and have pretty much my entire life. And starting about my mid-20s, I just started to notice a little ankle pain and a little swelling after I would play sports. Became a little bit more pronounced, and something I just kind of marked in the back of my mind. Hey, this is something that I need to check out. Probably just need to take it easy for a couple of days, give my ankle a break, that kind of thing. But over a course of, I'd say, months, it steadily got worse. The swelling continued to go up. The pain continued to increase, and to the point where I figured, okay, this is something serious enough where I should probably get checked out. So went to a physical therapist. Didn't want to see a doctor yet. I figured I could just do some physical therapy, strengthen my ankle, and it'd be fine. Of course, after probably about 6 weeks of physical therapy, they kind of threw their arms up and said, hey, we don't know what to do with this swollen ankle. You should probably go see a doctor. So I did, and we did all the imaging, and the imaging came back, and it was pretty rough. And the doctor said, listen, I think we need to do a full ankle reconstruction. Your ligaments are in pretty rough shape. You've got some arthritis, and as a young guy, you've been pretty hard on your joints, playing a lot of sports growing up. And so that diagnosis was pretty devastating. I did not accept it. And so I thought, okay, I'm going to get a second opinion. And ultimately got a second opinion from another doctor who disagreed, said, listen, I work with a lot of NBA players. I've seen that bad ankles. Yours isn't that bad. I think we should just scope it and just see what happens. So that was much more tenable to me. Did the scope. And he said, yeah, you should be back up and running in 6 weeks. I don't even think we need to give you a physical therapy script. You should be good to go. And, came out of surgery and 6 weeks later, not only was I in pain, I was in excruciating pain. And my ankle had swollen to the size of a melon. It was not good. And that just sent me on a path over the course of probably 5 years until I found mind body medicine, of struggling to find an answer for this pain, and seeking all sorts of different medical opinions, and to the point where I did a full day at the Mayo Clinic and kind of saw a bunch of experts, and ultimately the conclusion was you should never play sports again. Low impact activities. All the other doctors are wrong. I think your first doctor was right. This is a pretty rough situation, and really the only thing we can recommend for you is regenerative medicine. Kind of on the forefront, try stem cell therapy, those kind of things, to see if we can kind of regenerate the cartilage and tissue and your joints, joint. Tried that for months upon months upon months of getting, stem cell injections and prototherapy injections and all sorts of injections into my ankle. And frankly, it was my only hope and my only choice to kind of get back up and running again and kind of figure out some of this pain. But it became clear after about 3 or 4 months of going down that route, it just wasn't going to work there either. And the pain continued to get worse and worse and worse, to the point where had difficulty, walking short distances. I became a young father at that point and was having trouble playing with my kids. and just, enjoying life as a, person in my late 20s. Um, so that's kind of where I was.
Yeah, and it drives me crazy because I hear all the time when physicians tell patients, like, yeah, you need to stop exercising, you need to stop doing what you love. I mean, the research on exercise clearly shows that people will exercise to the extent that they like it. And so if we as medical professionals say to people, like, yeah, don't do what you like, do this instead, we essentially have like removed this incredible healing method from them. And so I just, it, because you were in your late 20s at that point, right? And
Yep.
so sort of hear that message just is, as you said, it's devastating.
Yeah.
So, all right, well, thanks for that background. Leah, I'm going to move on to you. And can you tell us sort of similarly what had happened that had found you in a place where you're having pain on a daily basis?
Yeah, so I had my first headache when I was 28. And when I say that, I literally mean my first headache I ever had. Never had one after, a stressful studying for an exam or a night out drinking or any of those. Like literally never had physical pain. And I was at the beginning of the school year, which as a teacher is a stressful time. And I had a zigzag go through my vision, which was very strange, but for many migraine people know that is called an aura, and had my first migraine, and that lasted a couple hours and was very strange. Had a couple fellow teachers tell me to pop some Tylenol. I'll be back in no time. And it just dissipated, and didn't think too much about it till the following week. I got my second migraine. And starting that date, I had a headache or migraine every day following. So it was a very sudden shift for me, from a time of physical health to a time of being in very excruciating pain very, very quickly. Which naturally led me to a lot of doctor's appointments, trying to figure out what this was. Saw neurologist, who was very quickly telling me it wasn't a big deal. Take a couple of triptans and it will dissipate. Me calling him back 2 weeks later, explaining that the migraine was still here, and that it wouldn't leave. My first couple of months were really really hard. I spent a lot of time researching, trying to figure out what was going on, calling doctors, trying to get in to see headache specialists, which were very challenging, in urgent care centers, receiving pain drips and things like that. But nothing really could make the pain budge. It wouldn't matter what pain pill I took or what medication I was given. They were all like very rarely made a big difference in my pain. And I mean, I think that sort of was the starting points of me going through a lot of the medical, like Western medical model of looking for specialists, like being told that there could possibly be an answer and following through on whatever the doctors told me to do. And so gratefully early in my search, I met a headache specialist in New York who really just honored my pain. And I think that was one of the most important things for me, as someone who was experiencing chronic pain that wasn't visible, was to have someone acknowledge that my pain existed. And he used the tools he had to be able to try and help me, which were, medications, scripts for physical therapy, coming in for IV drips and days of injections. But nothing really worked. And so as a teacher, I was pretty much debilitated. I went from working a full day schedule, very promising, top of my class teacher, to working half days, to then eventually I decided to go on medical leave, since I couldn't be in my classroom. I was noise sensitive, so I wasn't able to go out to restaurants and bars. I also lived in New York City, which is very loud. And so I would walk around the city with noise canceling headphones on, to try and like drown out some of the sound. I carried earplugs with me at all times, to be able to stuff in my ears, but I couldn't go to restaurants. I have a memory of my husband and I attempting and hearing the sound of like cutlery banging as they were cleaning forks and knives, and just like kind of leaving in tears and so much pain. And when I'm on medical leave, I ended up going to an outpatient chronic pain program in Florida, where I grew up, and started to learn a little bit about some alternative healing modalities, but it was very much this idea of we're just managing your pain. And so I learned about biofeedback therapy, I learned about physical therapy, worked with a cognitive behavioral therapist, and also received, IV drips and different types of medications. And the idea was, we're going to help you try and manage some of these symptoms and find ways to bring back some of the things that you like to do in life, but this isn't going to change, or we don't necessarily have a lot of indications of how this will change. At that point, my doctor had given me a diagnosis of a rare headache disorder called new daily persistent headache, which essentially means the headache is new, it comes out of nowhere, you have it every day, it's very persistent and doesn't respond to medication. And it has a pretty hopeless and terrible prognosis if ever Googled. And so at that point, I was both like trying to get comfortable with this idea that this could possibly be my future, but also there was a lot of resistance in me that that would be the answer. And so I spent at least another year before I found mind body medicine, working through integrative medicine with diets and nutrition, working with physical therapists, acupuncture, a lot of different types of modalities, trying to find some relief, but also just really struggling with this diagnosis that was given to me and what it sort of laid out as what my future would mean.
And this was a significant shift in your life at that point, right? I mean, prior to this, you lived in New York City, you worked a full-time job, you enjoyed going out, friends and husband, correct? Like this was...
Yes. Yeah, I was super active. I was a varsity athlete in college. I loved working out, exercising. I, was very dedicated to my job. I was dating people at the time, had multiple friends, lived in New York City. And so it was a huge shift and also really challenging as a 28-year-old because I looked around and no one else was experiencing what I was experiencing. Remember going to my best friend's wedding and having to leave halfway through because I couldn't be there because of how loud it was, and just how crushing that was as a really young person to experiencing something that I couldn't make sense of and saw no other people experiencing. And so it was truly very isolating for me.
Yeah, and it's really, I mean, for both of you and my own experience too, super confusing. A lot of people have heard the podcast I did with Curable in 2017, talking about how I learned about this in my experiences, same age, late 20s, and this distinct memory I have of being in a yoga class for people who were disabled and having 3 people help me with a simple back bend, and having this thought, like I can still remember this 23 years later. I was a varsity college athlete. How did I get here? It seems impossible. So thank you for that background. Matt, I'll move to you, and similar type story, but can you give us the background for where you were over those years?
Yeah, my physical pain started when I was like 24, 25. I was in my first year of law school and started to get pain kind of widespread throughout my arms, my fingers, my shoulders, and my head. And went a very kind of conventional route. Saw my general practitioner, and we tried some like anti-inflammatory medication and physical therapy. And all the time I'm still in law school, and it's kind of getting worse to the point where I have to like stop typing and just kind of like absorb as much as I can of the lecture without like taking any notes. And then I was referred to an orthopedic surgeon who did a surgery, and it just continued to get worse. And so I was branched out to see like a wide variety of kind of like concentrically narrowing specialists, like rheumatologists and neurologists and geneticists. And eventually one of the geneticists diagnosed me with Ehlers-Danlos syndrome and had me go see a specialist in that syndrome, which is like a hypermobility disorder. And it took a long time to get into that specialist. And as that was happening, the pain was getting worse and worse. I had a second surgery And it had gotten to the point that I was having a lot of difficulty falling asleep. I would wake up at like 2 a.m. In like so much pain that sometimes I would vomit. And because it was in my head, I ended up like shaving my head entirely so that I could put this like pepper cream that essentially just like burned my scalp slightly. Um, and and along the way, like a pain management doctor had prescribed me opioids, so I became heavily dependent on that. Finally, I got in to see the specialist for Ehlers-Danlos syndrome, and I'll never forget, like she made the analogy, she said like Ehlers-Danlos syndrome is kind of like if you were born as like a Pinto car. And so like you need, if you were a Pinto, like you need to go super slow. You need to get like double the oil changes you would normally get. You need to like stay off of bumpy roads. And if you do all of that, like you might last like, a fairly long period of time. But you can't do what other cars do, or you'll just break down. And so that was like crushing to me. Also super helpful, I thought at the time. Like if I'm reflecting back at the time, I was like, okay, like I just need, and so like that's what I did. She was like, you need to wear a neck brace. So I looked like one of those dogs that like has the little cone thing. And like I had this like helmet thing that was like an ice thing. And so I've got that. I've got my shaved head. I've got my cone. She's like, you need to get a retainer to keep your jaw in line. So I got this like really awkward, like invisible but not invisible retainer. So then I've got all that going on. I'm heavily dependent on opioids. I'm not leaving the house. I'm becoming super sedentary. So I gained like 25 pounds over the course of maybe like a year. Became super, super depressed. I remember for a long period of time, every time I would go through a green light, just hoping that someone would run the red light and just like end it, because I was living in like 15-minute increments. And when you've already been told that you're a Pinto, like it's like, I don't really want to see how this ends. And so it was just like a very slow grind after that. And at the time, I just kind of continued to plug away at whatever specialty the last specialist told me to go to and do what they said to do. But it just kind of continued to get kind of insidiously worse without like the ability to kind of like figure out where to go from there.
And it's interesting, the Pinto analogy. I don't think I've actually heard you tell me that before. You may have, but in retrospect, it's so limiting, right? Like you have this like very small, very careful life you have to live, and with all the accoutrements and the retainers. But I think you're right. Like at the time, it must have felt really reassuring to have an explanation, maybe.
Yeah, and it was odd because like as I tell that story, now looking back on it, I was like, well, that's probably not very good. That was like terrible medical advice. But at the time, it felt very compassionately delivered because it was like an hour-long appointment. So the doctor really listened to me and listened to my suffering and really like empathized with it. And she had Ehlers-Danlos syndrome. So there was an empathy level there or a sympathy level there. And so like I had never been to an appointment where a doctor like just listens to you for a long time. So whatever she said was going to be like, okay, like you're at least like treating me like a human, like you're also treating me like a bad car. But if you're willing to listen to me, I'll listen to you and do what you tell me, versus so much of the medical kind of advice that I had received before that was really driven on diagnostics. So, quick in and out, like here's what we're going to do, here's the procedures, here's the medication. And so, yeah, it was this weird confluence of like both probably terrible medical advice from a fear standpoint, but also like I think she was doing the very best that she could. It's just kind of a medical model that was very backward.
Yeah. And then how long do you think you had the symptoms before? And we're going to talk about how each of the three of you found out about mind body medicine in a second. But how long do you think you lived like that before sort of finding this model?
Yeah, so I'll answer the question in terms of like the way we think about time and then the way that I thought about it at the time. So like it probably like 8 years of like normal human calendars, but like in my head, it was like 8 eternities, because every 10 minutes took 10 years. And so, like, for instance, to put it in concrete terms, and I know Brendan and I believe Leah at some point have talked about this too, like, I think all of us, I know Brendan for sure can relate, is like, I hated my birthday because my birthday represented to me, people would be excited about it. And I'd be like, my birthday to me represented the fact that, okay, I'm 27 and there's a possibility that I might have to live until I'm 80. And you're celebrating that, like, I'm on like mile 2 of this like terrible marathon. So I think it was really like 8 years of normal time, but it, as anyone that's listening to this that's in chronic pain right now knows, that's a little bit misleading in terms of trying to like quantify time.
Yeah, it's essentially forever.
Right.
So, all right, so I'm going to circle back to Brendan. Do you obviously remember? So, what do you remember about finding about this concept of mind-body medicine, and how that came about in the midst of this?
Sure. Yeah, I was simply put, I was out of options. um, and towards the end, I mean, and kind of tagging on to that last question, I think my chronic pain progressively got worse over the course of maybe 5, 6 years. And so what I didn't mention was that chronic pain in my ankle and swelling actually started to spread. That pain became, lower leg pain, and then it became leg pain, and then it became kind of right side body pain. And so it became very clear that, okay, this isn't just an ankle joint issue anymore. This is something more is going on here, and something significantly more debilitating as time went on and fewer options were left. And so it got to the point where, at that point I was under the guise of, or the guide of, that hospital system, and they had recommended a month-long pain program. And I had considered it, and I had actually had a family member that had gone through the program and had really tremendous results. And so I was considering whether I was going to take a month off work. I was a pretty busy litigator. It was going to be a pretty big commitment. And so I was trying to figure out whether it was going to be worth the commitment. I think pride was in the way. I didn't want to feel like this young, 30-year-old, 29-year-old should be going into a month-long program like this. What's going on? And so it finally got to the point where it was so bad that I'm considering this. I watched the video, and during the video, the doctor's talking about the relationship of the nervous system and pain, and how, at times with people with chronic pain, you can kind of get this pain sensitization in your nervous system that kind of starts feeding itself. And that just started to make me think a little bit differently about kind of, having a physical origin to the pain. And so, like a lot of us do, started Googling. And really it was just thinking like brain pain, mind pain, that kind of thing. And actually ended up stumbling upon Dr. Sarno's book, The Mind Body Prescription. And so curiosity got the best of me. I found an Amazon, page for that book. I'm very, I don't know, analytical by nature. And so I was very skeptical. But I just started, scrolling through the comment sections. And if you've ever seen the comment sections on this book, it's like, it's outrageous. It's like, 4.9 out of 5 stars on like 10,000 reviews or whatever on Amazon. I'm like, this is bananas. And I remember there was, people would give a synopsis of the book in the comments section. I remember reading this, and this guy's kind of laying out the argument, right? And I think he described it as like a portal opening up. And I remember reading this, and I was in the middle of work, and like ignoring my work duties, and I'm like just like doom scrolling through this, and I see this comment, and I started reading it, and I'm in just terrible, like 8 out of 10 pain. I'm trying to get through the workday, like I'm just hanging on by a thread. It's very similar to what Matt was talking about, and I felt it budge. Like I felt like a little budge in the pain, and I was like, that was weird. So I ordered the book, and it came, and I think it came on Halloween. It was, I'll never forget. I read it, and I just crushed it in like an evening. And my wife put the kids to bed, and I'm just like crushing this book and finish it. And I remember waking up my wife at like three in the morning. I'm like, I figured it out. This is it. And so I thought it was just going to be gone in a week, and Dr. Sarno makes it sound like it's just going to poof, go away. And it didn't work out that way. And so I'm working on the book, and I'm thinking, I'm like 6 weeks in, and I feel it nudging, but I really don't feel a lot of progress. And so finally, I was on my iPhone. I just started plugging into the App Store. Like, there's got to be an app for this. I was like, Sarno app, and Curable comes up. I'm like, oh, this is pretty cool. And Curable, I think, was pretty new at the time, and had a podcast, a handful of the podcasts that have now grown into, basically what we're doing here today. And there was a episode of a young man named Aaron who had lower leg pain. And I listened to it, and I just remember it was like a gift from God. It was hearing his story, hearing his commitment to this, focusing on, a mind-body connection to this very debilitating leg pain. And in a lot of ways, I just found just a lot of similarities with this story. And it gave me some hope, right? And he just happened to mention, yeah, I worked with this doctor in Chicago. His name is Dr. Stracks. So I thought I'm 4.5 from Chicago. I should check out who this Dr. Stracks guy is. And yeah, here we are 2 years later.
Yeah. And just a couple of highlights of what you said. 10 years ago, if somebody was going to find out about this, this concept, it would be only through Dr. Sarno's book. Like, that was the only way to find it back then. And now a lot of people who are listening, like, have never heard of Dr. Sarno, which is interesting. And so if people are listening, they haven't heard of him. He was one of my mentors from New York City, who was really the first to popularize this concept. And I think we know a lot more now than he did then. It was 25 years ago, I think, that he wrote that book, but it was really the first person to get that information out. And then also, in his books, a lot of people, like, it's like 3 sentences, like, I read about this, I saw Dr. Sarno, and then I was better. And so, like, a lot of people have that, like, assume that's the model, and rarely does it work like that. And so it's helpful to hear that, like, you can read it and think, like, oh, this is it, and then still not know what to do or not know how to get better. And then obviously Curable's been around for 4 or 5 years now and has sort of exploded the amount of information that's available about this concept, and more information coming out all the time. Leah, how about you? How did you happen to get involved in this area of medicine?
So I'm laughing a little bit because my first introduction to Dr. Sarno, I essentially wanted to just basically like, fuck you to the person who mentioned it to me and the idea of mind body medicine. It was very early on, probably about like 3 months. And at that point, right, like I'm literally having headaches or migraine all day, every day. So like, there's never been a break where I experience not being in excruciating pain. And I'm seeing an acupuncturist who I've been seeing, going twice a week for 3 months. And he's finally like, I told you about the mind body prescription. I was like, no, what's that? And he's like, oh, it's about, John Sarno wrote this book, we need to dig into your repressed anger. Like, what are you like really angry about? And I just remember being so furious. I was like, this isn't my fault. Like, this doesn't have to do with me and my emotions. Like, I am in physical pain and I don't want to listen to you about this. And very much shut him off. And didn't think about it again. I think I'm curious enough that I probably bought the book on Amazon, started reading on my Kindle, and then listened to the stories of people who read the book and were healed instantaneously and thought it was a complete farce. And in fact, just made me more angry because it felt like it really denied my experience. And then shoved it away for 2 years. And I was reintroduced to the idea when I had a second really big flare up that led me back to the hospital. And I was back in the chronic pain program. I was back living at home with my parents. I was back on disability. And it was a truly just a heartbreaking time. I'm 30 years old, or 29 years old actually at that time. And the little bit of progress that I had made to like be back at work, working part-time, to be back living with my fiance at the time in New York. everything exploded and I was in such excruciating pain and was back in this chronic pain program. And I remember at the time I was also experiencing panic attacks very frequently with the pain. And I was working with a biofeedback therapist, which if you're unfamiliar, they essentially like hook you up to all these electrodes so that you can see your temperature, your cortisol level, your heart rate, and you work on breathing techniques to really sort of lower your body's physiological stress response. And I remember being in there and I'm looking at these graphs, and as there are negative thoughts and emotions going through my body, I am seeing my cortisol levels shoot up. I'm seeing like my temperature drop. I'm seeing my heart rate race, all these physiological symptoms that I am in a stress response. And it was sort of the first time that it really all clicked together, that like the emotional experience that I was having, the thoughts that were generating in my mind were shifting and changing the pain I was experiencing it. And as we worked on some of the breathing techniques, I started to just see some things change. And the graphs were helpful for me because it was helpful to see like, oh, like cortisol's lowering, like I feel 2% better, but that's 2% better than what I was feeling before. That was the first time, like she probably explained, you know, the relationship between the pain and the nervous system. But it was the first time sort of like I'm starting to understand like these things are linked. And simultaneously in this program, I was also working with a physical therapist and they were all sort of aware in the program that I was really anxious at this time, you know, having these daily panic attacks, super anxious about how to just live from moment to moment because I was in so much pain and none of the medicines were helping. And we're in Florida, which is, you know, a super like, you know, liberal state of like progressivism and alternative medicine. And the physical therapist kind of leans over to me. She's like, I don't mention this to everyone because most people aren't really open to these ideas, but I have this handout on this thing called TMS. And there's this idea that some of the emotions and pain in our body can cause like physiological changes that then induce pain. And I started reading it, and differently than when, you know, this was mentioned to me 2 years ago, kind of similar to what you were saying, Brendan, which was like, I had lost hope. There wasn't really any other hope of what to do. The doctors had done all the medications. I had tried all of the different sort of alternative therapies that were still physiologically based, and nothing had budged. And so that was my first kind of introduction to it. And at that point, I started to read the handout. I thought the idea was interesting enough, but I was in such a state of emergency, really, that it wasn't tenable for me to work on it in that moment. And I think like that's helpful for me in retrospect to think about. Like there are times where like the work I've had to do in TMS in my body, like I needed to be in a space that was like not in that level of emergency that I was in. Like the idea was interesting, but I just didn't have the capacity to do a lot of the things yet. And so it took a couple more months of me like still really relying on the Western medical model and pain pills and things like that. And then slowly inching my way into this model, and very much found it through a Google search. I think curable through Google search of like migraines, chronic pain, like TMS, this thing, what do I do? Because I still was skeptical of some of John Sonner's approach and the very like quick healing that was happening, and started listening to the Curable app and podcast, and heard one of the host who had migraines, which dissipated and completely went away. And that was the first time I'd heard of anyone's migraines ever going away. And that was unbelievable to me that that could possibly happen. And then of course I created a narrative of how like hers weren't as bad as mine and like there's no way that would happen, but you know, I was curious enough. And then I listened to the interview with Dr. Stracks, and I believe in your story, Dr. Stracks, you've also experienced migraines. Did I make this up? Did you know?
I had migraines, like I was not a terrible, like migraines are sort of in my family. My mom sort of gets migraines, like, you know, being a good soldier, like I wanted to be part of the family too. And so I would get them. The worst migraine I ever had, I actually still remember it, was August 8th, 1988. It was the night of the first night game at Wrigley Field. And I was trying to qualify for the US Amateur big golf tournament, and I made a double bogey on the 34th hole and missed qualifying by 2 shots. Also, like, I don't even know if you guys were alive in 1988, but it was like the hottest summer ever in the history of certainly Chicago, if not the world. And so it was like 98 degrees that entire day. And I remember, like, on the golf course, like looking around, no trees within like hundreds of yards, and having this thought, this was what, 32 years ago, like, this is the hottest I will ever be in my life. And to this day, that was the hottest I'll ever be. And so anyway, I made double bogey on the 34th hole. I missed qualifying by 2 shots. And then, like, the thunder rolled in, the game got rained out that night. And I was kind of scared of thunderstorms. It was like this perfect storm. And I just like, I had this memory of my mom driving me back home and my friend who had caddied for me. And I screamed the entire ride home because I was in so much pain, just hoping that my skull would explode. And so that was not the typical experience for me, but certainly I've had that, but not lately, but I've had that.
So there must have been either something in your story, or maybe something even from the Curable co-host, that kind of drew me to Dr. Stracks. And I had, at that time in the summer, I told myself I wasn't going to see any more doctors. I had driven up and down the United States seeing doctors. Like my life had just become solely focused on health and doctors and appointments and medications and therapies. And I told myself I didn't want to do it anymore. So I remember calling Dr. Stracks' office, very skeptical, and telling the receptionist about all of my skepticism of how I didn't really want to do this. But I was sort of curious about Dr. Stracks, and he had helped these people with their migraines. And she was like, I had migraines and Dr. Stracks helped cure me of my migraines. And I was like, yeah, okay. You're in Chicago. My siblings are in Chicago. I guess maybe this one. She's like, we can do a telehealth appointment. And I was like, all right. And that was the start. It was our first appointment. And, the first time that I really felt truly heard around my pain, and was told there was a possibility for healing. There was hope. That was huge for me, because that wasn't ever spoken of in any of my appointments with doctors. It was a very dim and dark future. And I don't blame them, because they were working with the knowledge that they had at the time, but was introduced through Dr. Stracks. I think you told me to watch a video you have on your website. It's like a 2-hour video, I think, about the science behind mind-body medicine. And that really sort of kicked off a lot of my interest, knowing, one, there was hope, there was someone who could help me lead through this process, and the amount of research and science that isn't necessarily widespread or understood by doctors today or used, but is out there, that really supported these ideas.
Yeah, and I remember when you and I met for the first time, I remember you talking about how it felt dangerous to have hope, that you had been to see so many different physicians and started down so many different roads. And I hear this from people all the time, right? So many people come to me after years and years of pain and different types of treatments, and sort of getting started in one direction and finding out that it's not helpful. And so it's hard for people to enter into one more new space and wondering what's going to be different this time than all the other times. But I remember that. Matt, how about you? How did you enter into this and find out about this world of medicine?
Yeah, so during those 8 years that I was kind of wandering around in pain, I tried basically, I felt like everything. And so that involved a lot of experimenting outside of the medical model, kind of simultaneously, still plugging away super type A within the medical model. And so my first experience with what I thought at the time was mind-body medicine was someone had me go see or recommended that I see a naturopathic doctor. And I did, and she was really about infusions and expensive vitamins, and I got the feeling she was a little bit crazy. Her office was in her house, and she had a dog, and she told me that she thought her dog was the reincarnation of her mother, which I remember which I'm not to judge, but I remember thinking at the time, because she left the room and it was just me and the dog, and I remember being like, am I supposed to address the dog as like a dog or like a human? But I say that story to say, like, I had some experiences, and I'm an attorney and an analytical individual by nature. So like that, I felt like I was being taken advantage of when I was there, because I walked out. She told me, like, take these medicines, do this infusion, do this other thing, and I walked out and it was like a $500 bill for like, and I was like, I just feel like this is not legitimate. And so for a while, that kind of steered me away from mind body medicine, because I think there's so many different words for so many different things, and it's hard to know like which things are evidence based and which things are not. And so for a long time, I just kind of kept a very guarded approach to anything that I felt like wasn't super scientific. Where I found my next like positive experience with mind body medicine was I did a 30-day chronic pain outpatient program through the Rehabilitation Institute of Chicago, which was I feel like it was a great like gateway drug for me into like mind body medicine. It was very focused on managing pain, and I would say it was very far downstream compared to Dr. Strax's program, meaning like they were focused on stressors in the moment, which was great because I had no experience with how to handle stressors in the moment. So at the time, it was super helpful, and kind of this basically laying the groundwork that how you experience the world around you affects your pain. But it was also very focused on like managing your pain and making it easier to live out the remainder of your days, which was just like an idea that I didn't embrace. And it also was a very time limited program. So you do it for 30 days and then you go home. But that was, I guess, like the first time I had an experience with mind body medicine where I felt like there's a lot here, because I recovered infinitely more from the 30 days that I spent at that outpatient clinic than I did the whole of my kind of like interventionally driven like pain journey. And so that, I think, set the stage and kind of like planted the roots for eventually finding Dr. Stracks and Leah and Brendan and like what we've kind of built together. But I think what really drew me to Dr. Strax's program was, again, the Curable podcast. I remember listening to several of the interviews with like Dr. like Tor Wagner and Dr. Alan Gordon, and people that are doing like what I perceived to be extremely strong evidence-based work, and the logic of neuroplasticity. And I kind of just like dove like a deep dive in, and it made so much sense to me from an analytical standpoint that I was able to really fully trust it. And then through that podcast, I connected with Dr. Stracks, and I think just to like toot his horn for a second, I think like what really helped me was this holding these two things at the same time, of like knowing all the evidence-based work behind the neuroplasticity of pain and modern pain neuroscience, and also Dr. Strax's approach, which is very kind of meet me where I was at that time, which I feel like is a rare quality in a doctor. And so when I had met with Dr. Stracks and we had kind of talked about a game plan moving forward, I felt very safe in terms of not being taken advantage of, which I'm sure a lot of people that are listening at some point in your medical community, there's very few things more vulnerable and more terrible than being in a lot of pain, going down this route, and also like trying to decide in your head whether the person that's helping you is incentivized by evidence-based like genuine desire to help, or whether it's genuine desire to help that's not evidence-based, or whether it's just literally not a genuine desire to help. And so I think that those things all kind of brought together was what kind of provided the ecosystem for me to feel comfortable moving forward.
Yeah. And then, so serendipitously, like this was all sort of going on literally at the same time. I met you all right around, I think it was late summer or fall of 2018. So I had been in my own practice for about a year. And so I want to spend some time talking about kind of how you guys made this pivot and got started and what's gone on since then. And so my memory of it is that Brendan and Matt, I know I both saw you in my office in the north suburbs of Chicago in Northbrook. Leah and you and I had a telehealth appointment. And my memory of it is that like we were heading into the holidays, and I do some classes similar to the curable groups, and that I didn't have anything planned because it was the holidays and everybody's going to holiday, like back when holiday parties were a thing pre-COVID. But that the three of you the stories were similar enough and your personalities similar enough that I think I said, like, I'm just going to create an opportunity to have you guys talk. And I think all three of you were there. I may have that detail wrong. And then my regular classes started in January. But what do you guys remember about sort of getting started with that, either seeing me or getting started in the groups and discussions, and how that started to evolve? Brendan, come back to you and start there.
Sure. So I'll start with the appointment. I think there at that point I was ready for some hope. So I think it sounds a little bit different than how I went into that first appointment with, or Leah and Matt might have went into that first appointment with you. I was at the end of my rope, and this I felt like I'd been working on it long enough where I knew, it was an intuitive thing. I just had this feeling that this has to be it. And so I went in with a lot of hope, and I remember, but still being, type A and analytical, I come in with like my 4-page like history and my own thoughts and all the research that I've done, and it's just like outrageous. I actually found it in for this. I'm not going to share it, but it's just like embarrassing how ridiculous it was. And I remember you and you were honored it, and you looked at it and you read the whole thing, and you kind of mentioned a few things, during our appointment that, led me to believe that you had, read it and taken it seriously. But you were just very confident. Just, listen, I'm pretty sure you have, TMS, and you will get better, and here's what we need to do, and X, Y, and Z. And it was really a breath of fresh air. And as Leah and Matt had talked about other healthcare providers, having listened to them, that's how I felt. I mean, I remember at one point I was just so frustrated being, shuttled between physicians and doctors, and here's someone that's actually taking the time to listen and asking unique questions. How's your stress level? What's work like for you? What's going on at home? You get too young kid. And it was I don't know, it just felt like a more human interaction, and that on top of the fact that I had done enough homework on this and enough inner work that I felt like intuitively this is somewhere I wanted to go, was really helpful. And then as far as that first group session, I will say this though, I was still very self-conscious about the fact that this is a mind-body issue. I think Leah mentioned, like, F you, this isn't my fault. And I had some very significant concerns about, what am I getting into? Am I crazy? Are the people that are going to be in this group quacks? And so I just remember meeting Matt and Leah for the first time during that call and thinking to myself, like, holy smokes, these people are, very similar to me and impressive. Man, they just seem like awesome people and not crazy. And so it was a little bit of validation of, man, okay, so if they're going through something similar and they found this route, maybe, this isn't insane. Because, still had those questions. And even, the founders of the Curable app, I think at that point I'd listened to their own stories, to the extent they were willing to share. I think the person who moderates Laura, I think her name is, who moderates, was alum of the same college that I went to, and have a high respect for the folks that I went to college with. And so it just felt like, okay, this is a community that isn't just crazy. As Matt said, it's evidence-based. So that first meeting with you and Matt and Leah, I think, kind of set me on the path of just like, okay, I can just take it easy and just recognize that this is a place where I should actually spend my time investigating, because it isn't, fool's errand.
Yeah, I always close the classes in the last week of just having people go around and saying something that they learned over the course of the class. And this last one before the holidays, we were going around, and one of my patients, also about your guys' age, said some version of that. She said, you know, she's had this pain for a long time. She thinks of herself oftentimes as sort of sickly and weak and ill. And she said, she's like, I was part of this group, and like all these people are just total badasses. And finally, she's like, at some point I realized, like, if I'm with them, then I'm a badass too. Like, I'm not sickly. And yeah, I've been hearing that more and more from people. Like, this is a community of people who are doing amazing things with amazing strength. Leah, how about you? What do you remember about sort of getting involved in either seeing me initially or starting to get involved in some of the groups and classes?
I remember from our first appointment, I left with this handout of sort of like how to approach my migraines differently. And, you know, similarly to what Brendan and Matt have said, like one thing that really struck me from my first appointment with Dr. Stracks was this idea of like truly being listened to and heard, and like my whole self, right? Like not just my physical symptoms, and that it truly mattered what was going on in my life, what my emotions were, what my thoughts were, what my family life was like. And that had never really happened before without it sort of being like, what was the weather like, you know, when your migraine first started? Maybe there was a barometric pressure, you know, like that sort of interest in other things that were happening. But that was the first time that I truly felt like very heard about my story and who I was as a person. Because at that point, you know, multiple years into a chronic pain story, I felt like I'd lost who I was. You know, like my identity had become my pain. And so now being able to sort of unpack some of those things I've been carrying was helpful. And I know one of the most helpful things early on was when you put me in contact with some of your patients. And I talked to two other women. One of them, I believe, was Jill Rydell, who's been on Hope for Healing. And I remember having such an incredible conversation with her where she's cured of, she had migraines for over 40 years, had been on tons of medications. And I just remember this one snippet of the conversation, which, you know, I was still very skeptical, and telling her about my skepticism. She's like, look, like, if it doesn't work, it doesn't work, right? You've done lots of things that haven't worked, but even if it doesn't work, you'll learn more about yourself by the end of the process. And that just really hooked me. There's, you know, her story of hope, which I wanted to believe in, but my own resistance to that. But then this idea, which is, it wasn't going to hurt me. Like I had taken medications, which had caused terrible side effects. I have, you know, been in hospitals where it's isolating, but it wasn't going to hurt me to try this. And so after talking with those two patients, that really sort of like really buoyed my like sense of possibility. Joining the groups early on, I just remember sort of stepping back and looking and saying, oh, you too, you too. And like a real big thing for me is just how isolating chronic pain is. And especially as a young person having chronic pain, it is not a story people talk about. And it's not like pain isn't something my friends talked about, discomfort. My friends are at the top of their careers right now who are getting married and having kids. And my life looked so different. And so to look across a screen in these groups and to have people say, hey, yeah, me too. And it might have looked different, right? Like they had different symptoms, different places where they had pain, but there was these parallels in our stories and journeys that just immediately spoke to me. And I mean, I know we went through many different topics from like mindfulness and compassion and journaling, and all of those were like really fascinating and interesting to me. And we'll happily, you know, later talk about those different modalities. But I think early on, the thing that really stuck out to me was the sense of community of other people, and that it wasn't a community of people here to like commiserate, like, man, this sucks. Like, it was people saying like, this is hard, and I'm pushing forward, and here's this thing that actually worked for me, or here's a shift that I've seen. And that was the type of encouragement I needed, because at the time, no one understood my experience. I couldn't talk to my close friends about it. I couldn't talk to in the same way with my husband about it, or my family, because no one had experienced it before. And then finally, it's just like this huge breath of fresh air to talk to people who understood, like, oh no, I understand how hard it is to get up to go to work every day, when literally 90% of your brain is only thinking about how do I move from moment to moment because I'm in so much pain, and how do I balance trying some of these new techniques with also like the pressure I feel to like be better from the people around me, or to like live up to different standards within society. So those initial calls were really helpful. And then sort of meeting some people that I don't know how else to say, just like my heart felt like these were going to be my people, and Dr. Stracks obviously was behind the scenes, like making some magic happen in these groups. But um, yeah, like just kind of like on a soul level, knowing like, hey, like we have similar stories, but also kind of similar ways of moving through the world, that um, just started to form some bonds of friendship and willing to take a risk of being vulnerable and sharing parts of myself with them.
And Matt, how about you? So, obviously you were there too, and sort of this time frame was your time frame also. What do you remember about getting started with this?
Before I got started, I was actually sort of hesitant about the group component. There was a group component to the interdisciplinary clinic that I had been to in Chicago. That clinic had kind of a workman's comp model to a certain degree. So a lot of people there were there at, kind of incentivized that they had to be there in order to continue on their like workman's comp program, which led to a lot of people like just there was a lot of negativity in the room, and I like absorbed people's negativity. And so I had this same experience. Actually, my wife and I had gone to like a support group in like my local town for chronic pain, and it just felt like everyone, it was very negative, and not in the sense that like these were negative people, but in the sense of like everyone was drowning and trying to like reach out to see like if anyone else knew how to swim, and no one knew how to swim, and so we were all just kind of like screaming. And also like it was a lot of old people screaming, and I wasn't old, and that hurt my feelings. I think made me feel sad, of like, oh man, if they're feeling this miserable when they're 67 or 77, like I'm 30, 27, whatever it was, like this is not good. So I had a lot of negative connotations about groups and group connection related to pain, also through social media. Like I tried Facebook groups, and I found those to be very unhelpful, for all the same reasons. Just like in a digital platform, like there's so many people and I don't know any of them, and they all seem super negative, and everyone's trying this CBD oil or that. Like it just almost like exacerbated my fear. And so like I was not super thrilled about the group component, but also like very open based on kind of the trust that Dr. Stracks had built like when I first met with him. Um, and so I think like a couple of things jumped out right away was that fear was like, I immediately recognized this was something totally different. Um, it was Dr. Stracks had boundary driven kind of like out of the gate like rules, about not giving advice to other people, which I really appreciated, because that wasn't we had tried enough advice, that wasn't the issue. um, and that everything was confidential, and also just the fact that there were a lot of young people, which was really important for me. For some people it might not be important, but for me it was really important. Like these were people that could feel pain, but also could feel like the extreme loneliness to be in your 20s or 30s going through it. And I really appreciated that. And um, yeah, I think the other thing that jumped out to me was like I expected to join the groups and get a lot of information that was super helpful. And I did. Dr. Stracks, provided a lot of information. Each week had a different theme. But really, like sometimes it's overwhelming when someone asks about TMS, because if I talk about the themes, they're themes that are like sort of saturated in kind of popular culture, like gratitude and positive self-talk. And not that not even to diminish those things, but I guess what I'm saying is what I came away with from our group was less the information and more all these motivated people that Dr. Stracks had connected in a boundary driven kind of environment. And I guess the last thing I'll say is it always reminded me, so I'm from Indianapolis. So Brad Stevens is a lore in the area. And he always has this quote about like groups. And he talks about how the key to like successful like teams or successful groups is that at the end of every night, everyone leaves the building heading in the same direction. And what I mean by that is not that like, oh, we all agreed on everything or our experiences were all the same, but everyone came to those groups every whatever it was Wednesday with like the same motivation and speaking the same language. And I think that was super helpful for me, is that, you know, we weren't trying to like decipher what each other were talking about, because everyone, Dr. Stracks had created an environment where everyone felt comfortable to speak the same language and kind of like celebrate each other's victories without just kind of dragging each other down.
And for those of you listening who don't know who Brad Stevens is, he currently is the basketball coach of the Boston Celtics in the National Basketball Association. Previously, the basketball coach at Butler University in Indianapolis when they went to the final game of the NCAA championship 2 years in a row. Matt, it's funny too, thinking about the rules and guidelines for the group and how important that was, because those are the only 2 rules and guidelines, which makes me think like in some of these other groups, maybe there aren't any rules and guidelines. But it's amazing how just those 2, right? This stays here and don't give anybody else advice. Like I've been doing this for a long time. And like, if we put those 2 guidelines in place, it really does sort of raise the safety level.
And I think like Dr. Stracks, there might be like a third like implicit rule that I think is really important, which is that like, I guess it's less of a rule and more of like a kind of a vagary of a rule, which is that like everyone came to the group with the intention of exploring pain from from a different way. And like, you didn't have to necessarily express that rule. And in fact, like, you encourage people to kind of like find that at their own pace. But I think that was a rule that I had never found before. Any other group I had gone, it was like, what's your secret icy hot? Or like, you know, how do you, you know, how often do you take showers? And like, that just gets super exhausting, versus like, there's just kind of less of a rule and more of a culture of like, we're going to work on personality issues and things that may have happened previously in your lifetime and things like that.
Yeah. And so anyway, so this was early 2019, so a couple of years ago. Obviously, there's been a long time between then and now, and so we're not gonna talk about everything that's happened in between then. But for those listening, spoiler alert: everybody is doing better now than they were then. And a little bit different to some of the guests who come on with me or Hope for Healing. Like, none of the 3 of you, would I say, is like cured in that sense. Each of you is at various parts of your own journey, generally doing well, having some setbacks and struggles here and there. And that's one of the reasons I invited the 3 of you on, is because a lot of times people will hear, you know, one of you, maybe Leah, talked about reading Dr. Sarno's book and like, everybody's magically cured, 2 sentences, that's all it takes. And then I've had other people say to me, even this week, like if they hear one more person say they're magically cured, like they're gonna throw the whole concept out the window. And so what I wanna do is spend a little bit of time now sort of thinking about some of the things you guys have done over this intervening time frame, and talk a little bit about where you are now, especially compared to where you were then, which I would say is amazing for all 3 of you, even if none of the 3 of you feels like, you know, you're somebody who says like, yes, I had chronic pain, I don't have it anymore. But thinking about some of the things that have been important and some of the milestones on the journey, let's talk about that for a little bit. And so, Brendan, when you think about these couple of years now, both in terms of kind of what's improved and what some of the sticking points have been, but also some of the things that have been helpful, in addition to having made the decision that we would continue the group in that format over that time period.
Sure. Yeah, well, I guess I'll just start with, you know, what's improved. And, you know, I won't bury the lead. My pain is significantly better. I went from a place of, you know, pretty much chronically disabled, and in a place where, as I mentioned before, I, you know, had on days, you know, trouble walking a few blocks. Our church is a few blocks from here, and I had specific memories of having to drive to church, which is 2 blocks away with my family, because I just couldn't make it. And so that's, thankfully all in the rearview mirror. The last 2 years has been tremendous, and it didn't happen magically. And all three people on this call would attest to that. I mean, it's been a lot of work and a lot of fits and starts and ups and downs. And but today my life looks, I just extraordinarily different. And I'll just stick with the physical for now. Today than it did, 2 years ago. Basically back to all the old activities that I like to do. Actually, not basically, I am doing them. Back to playing sports and running and cycling and doing all the activities and playing, wrestling with my kids and all these things that I couldn't do 2 years ago. Now. And the pain isn't 100% gone. It kind of will creep back, but it's a shell of its former self. And I think I'm kind of going on tangents here, but I think, a big difference in the last 2 years is just my relationship to the pain has completely shifted. It felt like something that was completely outside of my control 2 years ago to something that I can just view at a different perspective. Now when, I feel these, creeps of pain, and it usually manifests itself in tightness for me, that it's kind of this tension pain. It's, checking in with myself and being a bit more mindful about, okay, my body's telling me something. Why am I feeling this tension? Why am I feeling this back pain, this leg pain, shoulder pain, headache, whatever it is? That's where I start now. It used to be, oh man, I need to go get my ice out. I need to go pop some, Advil or something like that and take a rest, elevate my leg, whatever it was. Now it's, hey, what's going on in my life? And, you talk about what happened 24 hours ago, what's happening now, and what's happening, 24 hours from now. And I think about that a lot. It's just, what's happening in my life, some of the things that maybe I'm not recognizing. And more often than not, I can realize sometimes it's hard for me to find out exactly what it is, but I can tell I'm holding on to something. And that's causing this emotional tension, which is manifesting itself in pain. And so that's something that I'm still, dealing with. But the relationship has been completely different. As far as things that have helped, just from a 5,000-foot overview, I think the way I'd put it is just a journey of self-exploration. Who I am, personality traits, as Dr. Sarno would put it. I would identify as, type A, perfectionist, the do-gooder, all of these things, learning about those things, and, maybe there's a reason for those things. Why is that? Why do I feel like I need to, exercise so much control over my life? Why do I need to feel like I'm, this do-gooder? Maybe I should, respect my own feelings and boundaries a little bit more, those kind of things. And so that's been an important transformation for me. And something I just want to, plug the Curable app for. And one of the things that I took away from Curable is just the introduction to mindfulness meditation. Has been a huge addition to my life. And it's something that I now practice daily. And that practice has, evolved over the last couple of years. But it's just kind of what I call the armor I put on in the morning. It's, I meditate for 20, 30 minutes, and it kind of sets me up for the day. And I've started to notice if I don't, armor up and meditate and kind of start my day from a place of spaciousness and clarity, I can get kind of lost. Journaling, we've talked about. Self-compassion practice is something I'm just finally allowing myself to get into. It took a couple of years of felt too cheesy, frankly, but I think there is an aversion to it because I guess I'm pretty self-critical, and so that's somewhere I'm focusing. And I think we're going to talk about this a little bit later, but it just can't be understated how important, the group has been with you in the formal setting, with many others that are not on the call today that have been instrumental as well. So I just want to make sure that they understand how important they've been in this healing journey. But, Matt and Leah and I have been together for 2 years, and having them, as teammates, and watching them, go through, wins and losses and struggles, and have been a huge benefit to kind of go through this journey with them, to kind of learn from them, and act as kind of a scaffolding for each other when we might want to kick the can and give up on this mindfulness stuff or mind body connection. So that's kind of how I leave it for now.
Yeah, thank you. Interesting what you said about the self-compassion and just getting started with it. And because what I said recently, I think in your guys' group, and what I've been saying a lot to people is that the more I learn about this, the more I think that self-compassion is actually a required component of healing. And so the words I've been using is that like we can be hard on ourselves, like overly hard on ourselves, or we can feel better, but we can't do both. And so it's kind of a non-negotiable part of getting better. And what I find, and I've been studying cognitive therapy over the last year, sort of my like side COVID project. But the more I sort of delve into that, the more insight I get into what people are telling themselves in their minds. And if you had told me before I started that, like 2 years ago, how unkind people can be to themselves, even coming from somebody who over time has been unkind to himself, I would not have believed what people are telling themselves on a regular basis. And at this point, I don't think that we can all continue with that and feel better. I was talking to a patient earlier this week who about kind of what she was telling herself in her mind. And she said, she's like, I know the pain is fight or flight, but she's like, I don't understand, where's the fight or flight coming from? And I was like, it's coming from like you constantly being down on yourself. And so it's one of the topics that in my mind is no longer negotiable. It has to be taken care of as people heal.
Yeah, just one thing I'd just like to add before we move on with the self-compassion piece, at least for me, I think a big hesitation I had was it's going to take away, this is part of my drive. This is, why I've succeeded to the extent that I have, whatever my goals are, this is what helps me achieve. And it's been a recognition of actually, no, this is getting in the way of a lot of these things, being overly self-critical, and that actually starting from a place of self-compassion and doing things for the right reasons is going to, ultimately, and this is again, as Matt talked about how important science-based facts are, it's coming out in the literature now that, if you're starting from a place of self-compassion and not self-loathing or self-criticism, you're actually going to be, achieving your goals, whatever those are, much quicker and much more efficiently.
Yeah, and the goals and the high achievement, I think, is fine. I found a definition of perfectionism recently that said there's nothing wrong with having high standards, and high standards are good. And clearly, there's a lot of high achieving people who come to see me and are listening to you guys talk. But the problem with being perfectionistic or self-critical is this hostility that comes in when we don't meet those goals, especially if those goals are impossibly high. And so the standards and the achievement is fine, but we can't be uber critical of ourselves when we're not meeting them. That, as you said, Brendan, takes away from people's ability to get there. Leah, how about you? What are some of the highlights and mileposts that you've seen over the course of the couple of years as you've been able to really get that headache ultimately to really calm down and sometimes go away in a way that I would say probably it didn't for a long time. Like I don't remember until fairly recently you having headache-free days.
100%. I remember talking with you even this summer, just being like, I don't know what it feels like to not have a headache. That I have lost that memory. And I can like very proudly say now, like I most days don't have a headache, which is incredible. They're not completely gone. Like they come, like I kind of have one right now, probably because I'm a little nervous about this conversation. But it doesn't scare me. Like you were saying, Brendan, like my relationship to the sensations in my body has changed a lot. I remember there was an episode of Curable that came out in the spring where they interviewed a woman who I think she worked at the Pain Psychology Center and now works for United Healthcare, like her top 5, like things she says about like coming out of chronic pain. And one of the ones she said was like, you won't know the moment that you come out of chronic pain. And I was surprised. I was like, how is that possible? Like I've been living this for 4 years. I'll absolutely know the moment that I'm not in chronic pain because it's so the top of my mind. And then I finally sort of understood because it's the top of my mind, I couldn't not know that I was I was always going to, try and think the best way of saying this, because it was constantly on my mind. I was always thinking of the pain, and therefore I wasn't able to sort of like let it down. And I don't have an answer to how that happens, besides it just kind of slowly starts to. That fear response starts to soften as I've done different work and started to change my relationship, and now don't experience headaches most days. Like I used to wake up every morning and kind of judge what my day was going to be like based on these sensations and headache I had, and it was the first thought of waking every day, and it is not the first thought I think of every day anymore. And just like a really tangible difference, like I work full time now, and which was not something that I was doing. Previously, I was working part time, and very much kind of considered myself, like you were saying, Brendan, disabled. I work full time. I interviewed and applied for a brand new job within the education field, which was never something that I thought would have been possible. I had sort of curated a life that was going to be very small and different based on what I thought my limitations were. And travel and go places that are loud. Like that's something I kind of have to remind myself of. Like when I go to a concert, I'm like, I'm at a concert right now. I mean, not really in COVID times, but like I went to a concert last spring and my friend looked over at me and was like, we're at a concert. I was like, oh yeah, we're at a concert. And I go out to eat and, at places, and it's not a thing that I think of as like, how loud will the place be? In terms of some of the things that were like just things that I like still keep in my like toolkit right now that I really make a difference to me. Journaling was a huge one. I still journal most days, and have tried the John Sarno or the Nicole Sachs, like journal speak, like 30 minutes or 20 minutes every day. And I did that for a good chunk of time. And I don't do it the same prescription RX of like every day 20 minutes, but it is a tool that I now use to really help me kind of process when the pain is flaring up. Oftentimes now I know I'm angry about something or I'm really frustrated about something, and anger and frustration weren't emotions that I was able to tap into as a kid. Other people are allowed to feel angry in my family, but that was not an emotion that I was able to have, and that really got transferred into my headaches was an acceptable expression of my anger. And so journaling has been really helpful. Similar to Brendan, like my mindfulness and meditation practice has been really helpful in just helping me be more aware of my emotions, my thoughts, the ways that they might be triggering physical sensations and pain, and being able to do that first step. Where the first step for me is like I have to notice that it's happening in order for me to react differently, which is, I've spent 30 plus years acting in one way. So I at least have to first notice in order to make a shift and do something different, because those habits and reflexes are so ingrained, and very rightfully so, to kind of like, keep myself like surviving and safe and, through my childhood and, adolescence. But that mindfulness practice. And then I kind of feel like we're all kind of on the self-compassion kick right now. And just like knowing that is, really like where I feel like my work is right now is this like really starting to strengthen the voice in my mind that is the like positive, optimistic, affirming voice that is there. I definitely think most of the things that I say to myself would be like the most atrocious things I could possibly say to someone else, and they are just constantly going on repeat. And I identify as being perfectionistic. I'm pretty critical. I'm pretty high, self-critical. And so really starting to notice that voice has at one point, like is also like scary, right? Like I have this like voice that's chronically super mean to myself, but also that noticing is my first opportunity to shift. And so I've been really working on beefing up that muscle. As Dr. Stracks has told me, like these are muscles that I can build. It's not a binary, either you have it or you don't, but it's just something I have to practice and build up. And then finally, like our group is like that. Is like we joke around. It's like we're getting our tank filled. Like we're going to the gas station and getting our tank filled, and it's the gasoline and fuel that sort of keeps me going. Like Matt and Brendan have just been like just incredible like friends and supports, but also like Brendan was saying, we have a whole group of just incredible people that are like on this healing journey with us, led fearlessly by Dr. Stracks. And every time we meet each month, it is getting my tank fueled to like keep pushing ahead in this healing journey.
Yeah, thanks. And I want to talk some about the group and the group dynamic in a few minutes. It's interesting, just sort of echoing about the self-compassion. I was talking to somebody else in the group yesterday, and we were talking about self-compassion, and I was talking about the mean things that we say to ourselves. And she's like, is that not how it works in your head, Dr. Stracks? I was like, not anymore. And so we were trying to like tease that out, right? Because I at one point, like I was just as critical to myself as everybody else was. And it's sort of like fallen away over the past 7-8 years. And sort of have some specific memories. Like I took a couple of years long training in body-centered psychotherapy and sort of like, sat in the therapist role and the client role and the demo role, and have a specific memory of like being the demo person for strong emotions in this training. And like, I'm not a strong emotion guy for the most part, but it was my job in that moment with like 30 people watching to sit in front of the room and like let the therapist show how to elicit strong emotions from people. And we're sort of working on this idea, like for a long time, if I did something wrong, like immediately I'd be like, wow, I'm so stupid. I'm so stupid. I am so stupid. And he sort of elicited that out of me sort of in the midst of this big group, pretty vulnerable place, but something shifted kind of after that. And it's like shortly after I started noticing that I would say to myself, like, wow, you're so stupid, and be like, no, wait. Like, we don't use that language anymore. We don't talk like that around here anymore. And it started to click in, and that started to be the rule in my own mind. And I've thought a lot about that, and like, how do I transfer sort of that experience? And what you guys are saying is that, and Leah, what you just said really eloquently is that like, it's not a switch. It's sort of like you start to put it into place, and you start to recognize. The first thing is to recognize what we're saying, and then starting to say some version of that. Like, this is not the only option of how to talk to ourselves, and let's figure out some other options.
Yeah, and I just wanted to say one quick thing about that, because when that idea was posited to me, when we talked about like happiness and like positive emotions being like a muscle that I could build, and that compassion voice, there's at once like that idea seems pretty simple, right? Like you're like, I will just say positive things to myself and like tap into that. And the truth is, it's actually been some of the hardest work that I've done, and then I have to give myself grace for it, which is, it's been 32 years where I've lived in a pretty critical household that, is pretty worried and like anxiety prone. And I've had 32 years of like internalizing a lot of voices that are very critical. And so like, that's been a lot of my like compassion for myself recently. It's like, wow, this is really hard. But I also know that it's possible. Same way I know my physical healing is possible, is that changing that voice is possible, but giving myself some grace of the healing process takes time.
Yeah, that critical voice that so many of us have, like, it forms for very important reasons, whether it's like fitting in with the family or protecting ourselves from other people's critical voice. Like, it's essential oftentimes for the growing up process, just to survive, thrive in a lot of families. And so so that's one of the things that I highlight when I'm talking with people about this. Like, it's not there just to make our life miserable. Like the symptoms, like the physical symptoms, oftentimes it's there to sort of help us figure out how to move forward in the world in some kind of meaningful way. And that's why it's so time consuming oftentimes, or challenging to let that voice go, is because it's played a super important role for so many people over time. Matt, how about you? Some of the things that have been helpful over these couple of years, and a little bit about where you are now as well.
Yeah, I'm very good. I feel very grateful. I was just thinking, like, in terms of, it's very overwhelming to describe how I am. I feel like, because I'm so different. Um, I still have some chronic pain, but I'm back to doing like everything that I ever wanted to do, which is just an absolutely crazy thing to say, like given kind of the lowest of the low points. So, you know, I have two children, and there's not a week that goes by that my wife's really the one that notices it more, you know, like, oh, you just carried a heavy couch, or, you know, little things. And there are big things too. Like I feel like I'm someone that needs like goals. So having those like victories to be able to look back on when when I have like bumps in the road. But one thing that's been really helpful for me is movement. I'm not a very good meditator. I don't feel super safe sitting still, and I'm not good at sitting still. And part of, I think, this journey is realizing like what's good for me. Um, and so much of medicine is like other people telling you what's good for you. And I think what Dr. Stracks is really good at, and what having a group to like witness what other people are doing, is like developing the confidence that like I don't have to do what Brendan's doing. um, or maybe that is something I want to explore. But for like me, for the longest time, like I did an 8-week MBSR class, I did a 30-day pain program that focused heavily on meditation, and it wasn't like I wasn't good at it, just it wasn't helpful. I felt very frozen every time I did it. And one thing that I've really explored and has really helped my healing is the embracing the fact that like if movement through yoga, or through, like, I'm a big cyclist, if through embracing that is just like opened a door to healing in ways I never thought was possible. So like this summer I did like an Ironman, which was something that I never thought I would be able to do. And having those victories, like whether it's a small thing like carrying a couch, or a big thing like some sort of goal that I'm reaching to, makes it so much easier for me. I actually have a little notebook where I like draw pictures of like, or cut out and paste a picture of some victory, so that if I do run into a period where things are hard, I can go back and like visually tap into like what's going really well, like over the long haul. And I guess this kind of dovetails into maybe one of the upcoming categories about like our community. But one thing, I've used this example before when I'm talking to people about like Brenda and Leah and I's relationship, and other people in our group, and with Dr. Stracks, is that I'm lucky that my parents live relatively close to our house, and my wife's mother lives close to our house. So they have a lot of exposure to our two children, and they see them, you know, COVID aside, like maybe once a week, once every 2 weeks. And they're always like, oh, like my daughter's name is Jenny, like Jenny looks so much older, or she's doing this thing that she didn't used to do. And in my head, I'm like, you saw her like 6 days ago. She is literally exactly the same, because I'm so close to her that I don't notice the changes. But one thing that has really helped me is to, as close as Brendan and Leah and I are, we're different humans. And so like I see things in like I'm going to pick on Leah, like a couple of weeks ago, we have our own like separate like text chain, and also like a separate like Zoom call that we do just like without a moderator. But Leo was just like super nonchalantly just like, yeah, like I'm doing pretty well. Like I'm just not having headaches anymore. Um, and Brendan and I were like, shut the front door. Like, what are you talking about? You don't have headaches anymore. But like, I think it's hard, like when it's yourself, it's hard to see the progress. Just like as for like a grandparent, like they can see progress in because they're a little further back. So that has been really helpful to me to have that like perspective of like, I may be going through a tough week, but like Brendan just like crushed some goal, or like Leah is like getting ready to like make a big career move or something like that. I can hang in there, versus like when I left the clinic in Chicago, which was a tremendous clinic, but when you're done, you're done. And when you go through tough times, you're on your own. And the last thing I'll mention that has been really helpful for me is that I think or kind of mind body medicine has launched, all three of us, I think, would agree on this, us into areas to learn more that are adjacent to mind body medicine. So like, for instance, like um, learning more about like loneliness and its impact, and finding authors that research about that, and having a backdrop of mind body medicine in which to kind of frame it. But whether it's kind of trauma informed movement, or loneliness, or all these different things, that like there are all these wonderful experts out there. And I think in the field of kind of wellness, people get so dogmatic that I think one thing that Dr. Stracks is phenomenal at is avoiding that kind of like, there's one right way to heal. And that has really allowed, I think, all three of us to explore when it's right for us, different experts that are not necessarily wouldn't identify themselves as maybe even 100% agreeing with like our path to healing, but who have like a wealth of information that I think is really, I can just speak for myself, has really helped me heal by just continuing to learn from people, even if they may be in a slightly different field or area of expertise.
Yeah. Yeah. And Leah and Brendan, I know you guys want to chime in. I just want to, Matt, one thing, sort of talking about like skipping over important details. Like somehow I missed the Iron Man detail over the summer. And I sort of had it in my mind that you had done a triathlon. I thought it was sort of like an Olympic triathlon, but I just want to double check, like you ran a marathon after a 100-mile bike ride, after a 2-mile swim, like it was an Ironman.
So I did a 70.3. So it was like a mile 0.25 or something swim, and then like a 60-mile ride, and then yeah, the half marathon. So it was, and it was also like, I'm a fairly introverted person. So it was like the most introverted thing ever because it was during COVID. So like all the actual Ironmans were closed. So it was just like I developed a route throughout our city and just like did it on my own. So which was like the perfect introvert way to do an Ironman.
It's amazing. Leah, you had some thoughts.
I just wanted to just like echo Matt's point around like finding your own healing path. I think there's so many tools and techniques within the mind body medicine world and within the wellness like industry at large. And I think one thing that was hard for me at the beginning was I really wanted like a specific prescription. I wanted Dr. Stracks to be like, do this each day. And because very much this is what I was being told by other doctors previously. And, you know, they were like, take these pills, or you need to do this injection, or do this physical therapy this many times a week. And as, you know, well-intentioned as those pieces of medical advice might have been, it also took away a lot of my sense of agency and power as a woman and as an individual. And that's been a hard thing to sort of garner back, because I just so desperately wanted to be out of pain that I would cede all of my authority to someone else to know that. But along the way, having lost like an intuition of like, actually, what do I know I need in this moment? And so I know that there are many different people within the TMS world, some that have like more prescriptive programs and things like that. And I just would encourage you to say, like, try it and see what makes sense for you, what works for you. Like I remember like doing body scan meditations, and I thought they were the worst thing ever, but everyone's like, that's like one way to get more comfortable with your body. And I hated them because I was like, why would I want to be in my body more? Like I wanted to dissociate as much as possible. But now as I'm getting more comfortable, it's something that I'm accessing a little bit more because it makes sense for me right now. And so it's just an encouragement I'd like to give is that I imagine you might not think you know what you need, but you probably do at some sense have it's like an inkling and starting to trust that inkling of where to move towards in your healing journey and what would make sense for you right now, which might not be what made sense for you 6 months ago or even a month ago. And that's pretty incredible as we start to like, at least for me, it's been really incredible as I starting to like tap back into that sense of knowing what I need. With the caveat, which is like, it's hard. It's very hard because my first instinct is to ask someone else what I think I should do.
Yeah, absolutely. And I say that to people regularly, that it's part of why I like this work is because it's so individualized in people, but it is a little bit different oftentimes than like, do these 11 things and you'll feel better, which I think is what I would prefer to be able to say to people. But as you say, Leah, like everybody's pathway is just a little bit different. And so, I encourage people to start to, and I think trusting your intuition and bringing back some of the agency as part of the healing process. Brendan, you were going to add too.
Yeah, there's literally nothing I could have added. I think you hit on the casual Ironman that I wanted to give Matt some props for, because he dropped in the same way that Leah did with the headaches. it was like, oh yeah, this weekend I did an Ironman, and we're like, what? You just did that? So it was just remarkable. I just want to give him a hard time while we're on the subject. And then, yeah, I mean, Leah already echoed everything I could have echoed about. Just it's your own journey. And even though Leah and Matt and I have been on, through this together, I think we all agree that our own paths to our form of healing have looked different. So yeah, not too much I could add to that. Just wanted to add my own 2 cents.
And so let's talk a little bit about the relationship that you guys have formed with each other and with some other people in this community as well. Both the kind of formal, like getting together with me for what would be considered appointments each month, and I think even more so the informal network you guys have formed. And I may even take a little step back and let you talk about it a little bit. But what have been some of the, we talked and hinted at it, but maybe sort of just like, how did that evolve, and how do you keep it, as Matt had put it earlier, like, how do you keep it from devolving into like a lot of people yelling and asking how to swim? And how has it, for a couple of years now, managed to nourish you guys so substantially over that time?
Do this first.
Big
Go
question.
for it. I know.
I mean, let me just start with saying, so I think like one element is that it started in the incubation of like Dr. Strax's program. So I think there's it's worth saying that, like, I think that, it's easy to say like, oh, it just kind of like happened organically, and it sort of did. But I think like starting to go back to those rules, like when I look at our text, we have a text chain that goes, a few times a week or whatever. It very, very, very rarely talks about physical pain, or like searching for an answer. Which isn't to say that it's toxic positivity either, but I think we've kind of just organically found a balance between those two things where we share if people are having difficult emotional issues. And by that, I mean like struggling with something. It's not like, oh, Brendan's saying my ankle hurts. It's Brendan, I'm not disclosing anything, but like this is going on that's really hard in my life. But I would say, I mean, I don't know. I'm curious. I'll throw the question to you guys. I would say like 75% of it is like something, a victory that we had, or something that we're grateful for, or a resource that we found super helpful. And so for me, that fills my tank in ways that I can't fill it on my own.
Yeah, I completely agree. I think the vast majority of the content that we share with each other is um, completely not. Well, I guess if we're learning, they're tied together, but it's not talking about how we're physically feeling. It's a lot of sharing wins and resources, and man, the different avenues that I've been led down with Leah and Matt, the things that they've shared, whether it's podcasts or books or new studies about X, Y, and Z, and there's, like Matt mentioned before, there's so much tangentially related to the mind body, concept that it's kind of a choose your own adventure. I think early on, I felt a little bit of pressure if Leah or Matt would share a book or a podcast. Like, man, I feel like I have to read this, But I think we both learned now. It's like, no, like this is just an opportunity for us to, hey, this is helpful. Take it if you want it. Leave it if you don't want it. And it's funny. There have been a few things where I've kind of just passed over a couple times, and then finally, it'll pop up again, and I'll either listen to it or read it, and like, I'm kind of kicking myself. I didn't read this a year ago. So that kind of thing. And then, but as Matt said, it's not. I feel like we found this balance where we've developed this relationship now where we can be real with each other too. I think there's we don't want to bring each other down, but we also want to be real if someone's going through a difficult period in their life or something they need to talk about. We've, I think, developed this relationship now that we can uh, be real with each other. And okay, don't give me the cookie cutter version, like what's really going on. And not offering advice, but just trying to be a support network, and offering our support and going through rough times. And we've all had those, and we've all had pretty significant challenges outside of the mind body syndrome since the group has got together. And so just having that, especially during the COVID times where I feel like we're so isolated in general. Having this community together where you can kind of just cut through the noise and, you know, kind of the classic, hi, how are you? What's going on? Life's great, you know, whatever. It's good to have those relationships now where you can just cut to the core of things pretty quickly and just be real. And I just feel very grateful that we've had this opportunity over the last couple of years.
Mhm. Yeah, I mean, I was thinking, Matt, about what you're saying of how like kind of like incubated in the first couple groups we did with Dr. Stracks. And I think that that really kind of set us up in a really healthy way for a friendship and group because we already had this sense of what healthy boundaries could look like. And I think even having that shared language was really helpful. I mean, like if I talked to some of my other friends about boundaries, they would look at me like with a very like skeptical look. But you know, that's something that we've talked about is like, you know, how to have healthy boundaries in our relationship, how to you know, ask for help when we need help, but also like be like, hey, like not sure if you're in this place right now, but you know, wanted to share this with you all. And I think like this kind of like shared vocabulary and mindset of the way that we are not only just experiencing physical sensations and pain, but also kind of some of this outlook on the the world and you know and how we're moving through it has been really helpful. You know, yes, like our text chain is full of, to me, it's like yeah, it's just like a wall of inspiration, source of inspiration, but also just like encouragement and positivity and support, but also like vulnerability and honesty around like this thing being hard and being able to hold both of those two truths at the same time. And I think that's something that gets mirrored very well in our larger group and the other people that we are in community with, and being able to kind of show up for one another in that way. And I guess sort of lastly, I feel like there was this conversation we had kind of early on, Matt, Brendan, and I, around our group, and we have been willing to have conversations where we kind of step back and look at our like our relationship. And one of the ones we did early on, which I thought was really healthy, was, hey, would you still want to do this even if all of our physical sensations went away? And I remember each of us being like, well, yeah, like we're friends, and like we're not friends just because of our physical sensations or pain that's there. And there was something about that, and knowing it wasn't this transactional relationship that was contingent upon being in physical pain to be in relationship with one another, that we talked about early on when we were both when we were all in a lot of physical discomfort. And I think that to me was really crucial in saying like, oh, like this is a relationship that's different than something where I'm just going to get something from other people, that like transactional. It's more.
And, you know, I noticed that too, sort of, you know, as we've gone along, you know, when we have these monthly calls, we'll structure it. There's eight of you plus me, so 9 of us total. And frequently, like I'll ask everybody for updates, and everybody will talk for 5 or 7 minutes. And frequently at the end of that 5 or 7 minutes, I'll recognize that whoever's speaking hasn't said a single word about how they're feeling physically. And so sometimes I don't even bother. Sometimes I'm like, oh, you know, how's your back, or how's your head? But I've noticed that as people learn more about this, it becomes much more about what's going on in our lives, what's going on in our minds with our emotions, and the focus oftentimes gets moves away from the physical sensations, which I think is probably hard for people to believe who are listening, but I oftentimes will notice that fairly quickly when I'm working with people, which doesn't mean that the like other challenges aren't substantial, of figuring out how to be kind to ourselves or let our emotions out or be vulnerable, all these skills that help to make the pain go away, but I think oftentimes are even harder than managing the physical discomfort. So thinking about, we're going to wind down within the next few minutes, but thinking about sort of what I said a little bit earlier, that all of you are just such a different place than you were 2.5 years ago when I first met you. And none of you, would I say, tell me that you feel like, okay, your work here is done, and there's no more physical sensations. Any thoughts about sort of how you manage that tension of having come so far in your journey and feel like there's still things that you're working on and ways to go? And then a little sidelight, if you want another piece to comment on, is oftentimes people sort of get started in this journey and feel like they're really not improving at all. And when we really break it down, we find out there's actually been substantial improvement, but it doesn't feel like that for a variety of ways. And so either of those thoughts on either of those subjects, sort of the continued journey and sort of noticing the improvement when it's there.
Yeah, I can jump in. I'll start with the, not noticing improvement. I felt like that was so much of the first, God, call it 4, 5, 6 months at least before I really even realized much of a significant dent of it. And so, I would feel, a little bit of kind of movement and the relationship to the pain, but it's hard to describe. And a word that I was not aware of before we began this journey is like felt sense. This idea of something that like it's almost like intuition. Like I just feel something from the body that just feels like this is intuitively right for me. And I kind of had to work with that faith. And I think, for me, it was right time to get into TMS because I was, out of other options and I had felt this movement. But, I know that putting myself in the shoes that I was back then, I would like to hear someone say that is, in a much different place, like, keep going. If you feel intuitively that this work is worth it, keep going, because I personally can only speak about my experience, but I am, eons better than I was even 6 months ago. It just continues to build upon itself. And then leading to the next question about, how do I keep going? It's like, oh my God, it's gratitude. It's how could I not? It's, for someone that's in chronic pain, for as long as, the three of us in this call have been in, it's hard to describe the place of desperation that I think all of us were in. And I can speak for myself. And I remember a specific moment. I had just got done mowing the lawn, and this is before I found TMS. This is like, when I was first starting to think about chronic pain programs. I came back inside and I was in such full body chronic pain that I just took a bath and I just felt like, this is it. This is the rest of my life. This is over. And so when I paint it in that context, which it's hard to remember now. It's hard to say that out loud. But when I think about it from that context of, hey, I've got a little bit of pain. I feel a little bit of discomfort. I'm dealing with these uncomfortable sensations that I really want to avoid right now. I've just seen the proof is in the pudding if it's eaten. I've just, by doing this work, I've just seen so much of my life transform and change, and new connections in every sense of the word, physically, mentally, spiritually. It's been phenomenal. So frankly, I can't imagine any other possibility but continuing to do the work that we've done.
I love that so much, Brendan. It's like that last line, like I can't imagine any other path. And it's sort of like what Jill Rydell told me in that phone call, which is like, well, like you'll get to learn more about yourself. And it's ironic because when the last 2 years in which I've been, deeper in the mind body medicine world, which I experienced tons of chronic pain, were simultaneously some of the happiest years of my life when I kind of look back on the last 32 years, because I've been doing things that I like wanted to do or didn't even know that I wanted to do. And so like that, that dichotomy is very, very strange. And if you're listening to this and you're like, that makes no sense, I completely understand. That might not make any sense at all, and might not be where you are, which is completely okay. So for me, how I hold those two tensions, I actually think it's important to hold them together. Is how do I sit in the tension of not being, quote unquote, cured, and how do I look back on and like think about, improvements. And when I look back and I celebrate the wins, I'm able to see that things have improved and gotten better. I like for a very long time thought that success had a really single storyline. Success meant that I was free of all of my headaches and chronic pain. And I think that that narrative is really well intentioned, but can be dangerous because I don't think that there is a single story along your healing path. That there's actually, for me, lots of mini moments of success. And so as soon as, you know, and Dr. Stracks, I feel like you really helped me with this, started to change what I considered success look like. That's when I started to really notice so much improvement. I remember telling you, like, I have no idea what it feels like to not have a headache, but I think I have like, you know, like a 1 or 2 on the pain scale. It's like, what if we just called it a 0? I was like, I don't know. Okay, let's try it. And like even that idea was just a total reframe for me to start to see like, oh, like this is a moment of improvement and this is a moment of success. And so if you're listening right now and it feels like maybe, you know, you're not at the success narrative that you've portrayed, you know, I'd really encourage you to look for those little wins because there's been so many of them. And I know they're hard for me to hold on to. And Matt, I'm taking away your little journal. It's like, maybe I want to like put them down and visualize them more, but those have been really crucial to like keeping up my momentum. Because like 2 years ago, I never would have thought I would have been full-time working ever again. And like, and now I don't even think about the fact that I'm doing that. And I need to hold on to that. And I think that's sometimes where the community and friends and family can be helpful to kind of mirror back the things that now we consider to be just so normal.
Matt, any thoughts from your end on either of these?
I think Brendan and Leah put it so well that I'm almost intimidated to add to it, but I reflect everything they said. I think like just to toot it again, but the value of a community is humongous for the times where things are not going well, and this idea of like kind of that there's no, I think there's in a lot of parts of our lives, especially like in a world where like things are condensed down to tweets and, you know, small nuggets of information, there's a narrative that like it's recovery's a binary thing, and life's not binary, right? Like there are challenges, and all three of us, especially this year, have gone through different challenges, and like you're gonna have ups and downs. But the one thing that always sticks with me, Dr. Stracks tells the example of like a roller coaster has to go, like the momentum to go down to go up. And you know, I'm sure if someone's in a lot of pain listening to that right now, it may come off as a little bit flippant on my part of like, oh, I don't want to go down to go up. But I would just say from my experience, like anytime that I've had a really bad stretch, it's always followed by like a really good stretch that I think needed that momentum to learn. So all of that's super ethereal, but for me also is like super true that and I almost don't want to ever not be in pain, because I think pain is a signal to me to approach things differently, or to have some sort of introspection, or to rely on other people. It's really like a learning tool. Not that I want to ever be in like the type of pain I was in before, but a little bit of pain isn't all bad. Like it's part of why we're humans, and it's there for a reason.
Yeah, and Leah, the podcast that you referenced from the summer on Curable's podcast with Christy Wiebe is the therapist who's out in Las Vegas with United Health now. And she says like she really appreciates that her body sticks up for her. That's how she puts it in that podcast. And that the pain, as you guys know, the pain is not the enemy. And I really liked how she phrases it, that it's her body telling her and reminding her that there are things that she needs to take care of that she's not taking care of. We're going to stop in just a sec. I'm going to actually go backwards for 1 sec because there was a question that I wanted to throw out and just get some quick thoughts on. But people who are listening and hearing you talk about the community and having the thought like, okay, that sounds great. How do I do that? And you may not have answers. I mean, the common answer that people can join the curable groups, they can tap into my classes. You know, lots of people are listening and watching on Facebook, and so Curable certainly has a robust Facebook group, and Nicole Sachs has a robust Facebook group. Any other thoughts, and you may not have any, but any other thoughts on sort of what's allowed you to find a group that has been really nourishing and supportive as you've been walking through this?
The first thought comes to my mind is just to take a risk, to take the risk to like either join the group, whether it's curable groups or one of the Facebook groups or one of Dr. Strax's groups. And even then within that, like kind of trusting some of your intuition. If there's someone in that group who sort of like speaks to you, or like, there seems to be some sort of connection with your story, say hi, like try to reach out. I think as an adult, that isn't how I typically thought of making friends. I just kind of kept whoever I had in my circle. And, I've been really lucky that it's actually kind of worked out when I've kind of taken that little leap of, joining a smaller group and like being like, when someone mentioned a text chain, being willing to do it. And another person in our group I've become really close friends with, we were at a workshop together and we're sitting near each other. And I just sense that she might be like similarly minded. And I give her my phone number, like an awkward first date, and we've become really close friends. And so I, might not always work out that way. You might be like, no, this isn't what I want to do, but it could turn out to be a really beautiful thing that is possible.
Yeah, I was going to second the workshop idea. I know Dr. Stracks has done an in-person workshop that all three of us attended, and COVID makes that difficult, but I'm sure down the road, like that's part of the long-term plan because it works so well. And I think like similar to that, which is harder in COVID times, is to like get off our phones and our computers. I think one thing that the workshop was really powerful for, and that Dr. Stracks heavily includes Zoom, like face-to-face within his treatment, is like meeting people, like, and even if it's on Zoom, like it's just so much more powerful to build a connection than it is just trying to find friends on Facebook or that type of thing, which is, it takes more effort, and it, as Leah said, more vulnerability. But I think it's key to actually like get to connect with humans like on the way that we're like evolutionarily designed to like connect.
And so, thank you. And we're going to end there. We're right at 2 hours, so we'll go ahead and sign off. But I am unbelievably grateful to all three of you for being here today, talking about this, being open, being vulnerable, being supportive, like you always are. Also grateful to other people that you've mentioned who are in that Monday night group with you and have continued to get together every month for a couple of years now, and work on this and share successes and share struggles. And I know how much everybody who's listening appreciates you guys being here, spending your time, donating your time, and donating your experiences and what's been helpful to you over this time period. And I also want to thank everybody who's been listening to this extended discussion. And each time we record, I am touched again by how brave and creative and wonderful this group of people is who is working on this solution to chronic health issues that is so different than what's normally talked about in the medical system. And so bravo to the three of you, to the people we work with in this particular community, and to all the larger community out there that's been watching and listening and learning. And so, as I said earlier this evening, we've expanded our telehealth options. And so people who want to connect with me directly are able to do so no matter where you are. So go ahead and contact us at www.drstracks.com. My staff will get back to you with all the information you need to know. And if you're listening and enjoyed this episode, you can find the recording to watch again, and all our previous episodes at Curable in my Hope for Healing page at curablehealth.com/hope for healing. You can also sign up for either of our newsletters to get updates about next episodes and everything else that's going on in our practice. I will be back without the three of them in 4 weeks on Wednesday, February 10th, 5 p.m. Central Time for the next episode. I hope you can join us then. Until then, please stay safe and healthy, and have a good night, everybody.
Thanks, everybody. Thanks, Dr. Stracks.